Rick, take it away.
All right. Well, I wanted to thank everybody for joining us tonight. I'm Rick Rittma, the hardworking mortgage guy with Advisors Mortgage Group. I'm really excited to be a part of this presentation because I've gone through this process fairly recently with my mom and my dad. And had I known everybody on this call, the presenters, it just would have been so much better. It was a very difficult process to navigate, even with my 5 brothers and sisters. So I think that you're going to find that this is extremely helpful. There's things I never knew about that would have been extremely helpful had I known about it, but I just didn't. These folks can make this process significantly better for you. They can eliminate much of the stress that you feel, not only as you approach it. I don't know if you're feeling that, but I certainly did. As you approach it and as you go through the process, it really does help to have experts who know how to drive through that process. And these folks know how to do that. And I just think we've assembled an unbelievably knowledgeable and caring group of people. And I think the caring is a big deal. And they're resources, and they really know exactly what to do, and they can really help you and your loved ones stay proactive as you age. We have taken the premise that I'm looking to provide assistance to my aunt and uncle, Mike and Sally, who are 64 years old. And as we start the presentation, we are looking for the Medicare options. And through each conversation, we're going to connect the resources to keep me and my aunt and uncle proactive as they age. At the end of the presentation, we'll take all your questions. And now we're going to present Empowering Older Adults. Hi, Mona. How are you doing?
I'm fantastic. How are you?
I'm fantastic. I appreciate you taking my call. Look at you all dressed up, working from home.
Happens a lot now.
Yeah, I guess it does. Hey, listen, I've been thinking about my aunt and uncle, Mike and Sally. So they're getting older, as we all are, and they have no kids. So it's kind of up to me. And they're getting all this mail about approaching the Medicare age. They're seeing the TV ads, and I just want to help them out, but I feel really, really lost. Should they enroll now? Is there a certain time that's better? What should they do?
Yes, those ads, the TV and the flyers can be so stressful, especially if you don't understand them. I'm glad that you talked about timing, because timing's important when you're thinking about Medicare. Some things are time sensitive. So that's where I can come in to meet with them, not to make the decision for them, but to give them all their options. There's so many things to choose from between a Medicare Advantage plan, a supplement, a Part D medication plan. We'll sit down and go through all of those and really decide on a couple things for timing of whether they're going to continue to work or whether they're going to retire, because that decision will make a big difference on the options that we have.
Okay, so I need to get them set up to meet with you, but what kind of things should they be doing and kind of considering in advance?
Well, a lot of people assume that Medicare is free, and it's not. And so, as I said before, the timing is really crucial. I'm an independent agent. And so what that means is that I will look at all the options for them. We'll sit down in the meeting. We'll look at their healthcare history, their medications, what doctors they go to, what hospitals they want to go to, and come up with the options for them based really a lot on the cost and the kind of care that they want to receive. Having the right information will alleviate so much stress for them. And just knowing when they make a decision that they've got a plan in place will help a lot.
So that's an important distinction. Medicare isn't free. There are many things that need to be added on. So what should they do moving forward?
The best thing is to have a review. That way we can ask questions, I can present the plans, and we can find the best option for them. As I said before, sitting down and just knowing what plan is important. They may not want to retire now, but they need to know what their options are, because it's going to relieve so much stress. So having that initial review, and then once they get enrolled, As you guys know, healthcare changes every year. So having an annual review is really important to make sure they're on the right plan. And if there's things that change, then we can adjust that. But an annual review once you're enrolled is really crucial as well.
Okay, so that's an important distinction. I'm sorry, I got to get them in to see you. So what about Social Security? Is that something that you do?
It's not, but I know someone that can help you. Let me get him on the line. Steve,
Great.
are you there?
Yes, I am. Hi, Mona. What can I do for you?
I have Rick here that is trying to help his aunt and uncle, and I know you'll be a wonderful resource to him.
Wonderful. Thanks.
Yeah,
Hi,
I
Rick.
was just, hi, how are you doing?
I'm well, thank you.
Great. I appreciate you talking with me. I was just telling Mona they're getting the ads. My aunt and uncle are getting the ads in the mail, seeing the TV commercials. And Steve, do you start taking Social Security? When do you start taking the Social Security benefits?
Rick, that's actually $1 million question. You can take it as early as 62 or as late as 70 plus. And if they're a husband and wife, they can take it at different times. If they're each have a benefit of about 2,500 a month, that equates to about $1.2 million of income over a 20-year period. So it's that $1 million question that we have to kind of figure out what works best for their bottom line.
Okay, so it sounds like there's a variety of decisions to make, not just when.
Yes, you're actually, there are a lot of options to choose from. And a lot depends upon what they've already saved and what they really want to accomplish when they're in retirement. Do they want to travel? Do they have a need for extra care while they're getting older? A lot has to go into that figure, that computation.
So, their health is great now. They really don't have a problem, but I'm thinking, that it always is a factor. So is that part of Social Security?
It's not part of Social Security, but you have to use some of your benefits for that care. We're living longer. Modern medicine is allowing us to really have elongated lifespans. The hard part about that, like I'm feeling and you might be feeling, is our joints are getting achy. They're starting to break down. There might be some cognitive abilities that are going on. So the concern becomes, how do we manage this for our parents, for ourselves as they get older?
So are there triggers to look for when deciding about the additional needs and costs that they should be aware of?
Yeah, one thing that it's called activities of daily living, and there's about 6 of them. Do people need help bathing or dressing or getting out of bed into a chair or chair into a bed? They need help eating. Do they need have struggles with continence? When you have a need for 2 of those, what they call ADLs or activities of daily living, that's where there are benefits out there, either through Medicare, Medicaid, or private plans known as long-term care insurance.
Okay. What about the cost?
Yeah, the cost. It depends on where you're at. If we're looking at Indianapolis right now, if you're doing a mid-range nursing home, the average cost on an annual basis is about $92,000, which, you start going 2 or 3 years out, that's a good amount of chunk coming out of the retirement fund. You might want to get a hold of a gentleman named Dave Holder, but right now that's what the cost is.
Okay. With all these questions, I'm thinking about their house.
Yeah.
It's a 3-story
Big asset.
condo.
Mhm.
And man, it's a lots of up and down, and they got to think about, relocating, how they're never ready for that. And there's so
Yeah.
much stuff in that house that it has to go before this can happen. Is there someone we should, be talking to now?
You know what? The perfect person I know you should be talking to is Susie Malley. She's fantastic in this area. Let me get her real quick. Do you have time to continue?
Yeah, sure.
Perfect. Excellent. Susie,
Hey,
are you there?
Steve. Yeah, how are you?
Well, I am well. Welcome back from your world travels. Hey, I have Rick on the call. He has an aunt and uncle that he's working through, and they're thinking about transitioning into a smaller space. Do you have time to talk to him?
Absolutely. Thanks for introducing us.
Glad
Hey, Susie,
to.
are you there?
Hey, here I am, Rick. How are you?
Oh, I'm doing great. Thanks. Hey, I was telling Steve about my aunt and uncle. They're getting into their 60s, and they have a 3-story condo, and it's filled to the brim with stuff. You know how that happens.
Yep.
Um, What's the one thing I should know?
It's a great question. And what I would say that I've learned over the years that I've been working with seniors is that our stuff can paralyze us. So even to the point as we age, it's harder to navigate life. You can almost not want to do a transition because your stuff can really hold you back. So what I've encouraged is, to really start processing in the least emotional places and start taking care of getting some of those things that your aunt and uncle are not using right now out of the house. So I would say the stuff can paralyze us.
Okay, that makes sense. It's hard for me to estimate how much this is going to be, and and it's going to be emotional, of course, for them.
Mhm.
Um, how can my aunt and uncle get a jump start on this process?
Well, again, I say start in the least emotional places in the home. And for your aunt, it might be the kitchen, it might be the pantry, for instance. I mean, I know just for living in my kitchen, I forget when things have expired or, so it's just kind of committing every week for maybe 15, 20 minutes a day, maybe one day a week, maybe 2 days a week, that your aunt and uncle go in those places. For your uncle, it might be the garage, it might be his tool area, it may be the basement, the mutual area, which would be maybe a library with books that they've read. And, a move is always estimated on weight and distance. So, books become very heavy. And over time, I've noticed a lot of my clients collect those kinds of things. So again, really trying to figure out where are those best places to donate or, just get rid of those things that are not to Mother Earth, but to great communities that are accepting those items right now.
Great. So if my aunt and uncle plan on giving family members
Mhm.
and maybe some charities some of their items, would you suggest a system for that process?
Yes, absolutely. We use a color code system. So if your aunt and uncle are staying in their home, nothing would be coded. But for instance, if they were giving items to you, they would designate a color code for you. So everything with that code would, signify those are your items. If they have a special church or friends, a lot of our clients will invite friends over and say, please take something from a specific table. So we stage certain areas of the house, and it's a great way to figure out what is staying and what needs to go.
Yeah, that's excellent advice. What do we need to do with like the non-valuable items? Maybe usable furniture and that kind of stuff, but they don't really want to take it to their next stage, that next chapter.
Well, it's an excellent question because so many things have changed since COVID. But in Indianapolis, I am really utilizing 3 different philanthropies who are very receptive to receiving items. One of these places has 2 different philanthropies under one roof, and that's Thrifty Threads at 86 and Ditch. It's not your typical Goodwill. They represent the Julian Center for Abused Women and Children and the National Association for Jewish Women. So it's a great cause. And then there's a store downtown called Mission 27 for St. Vincent's de Paul. And they have a voucher system. So if people are homeless and getting back on their feet, they can go shop for free in that store. So it makes my clients feel really good that their things are not being tossed. And especially for me, not tossing in Mother Earth. And there's really wonderful places that are accepting these items.
Well, how long? And again, I really, it's a great information, but how long does it normally take to downsize on average?
Well, today we're moving somebody on Friday. So we went in and did it backwards. We're taking everything out of the house that was donatable or to a daughter's, and we've packed. Tomorrow we're going to move it, and Friday we'll set up the space. And the client's actually closing on their condo Friday while we're moving them. So
Wow.
that's kind of an intense move, 3 days. But I would say for your aunt and uncle, because they're not really at a deadline right now, I would say a typical transition is about a week, believe it or not.
Okay, that's quicker than I would have expected.
Yeah.
So how much is this going to cost them?
Everything, I work hourly, so I do a free consultation, and I would love to be invited to your home and meet your aunt and uncle, and I can walk around and kind of evaluate what it's going to cost and how many layers we're going to have to do to prepare to purge whatever is leaving the home. So that's basically how I work.
Okay, that's great. Now, if we do decide we want to sell the home, which is part of this process, it sounds like, who should we talk to?
Well, we work with different real estate brokers, so I would love to be able to put you in touch with a variety of brokers that we work with, depending on locations in the city. But at the moment, Kate McGill is my sister, and she works, and she just started her own brokerage company. But I think any one of us on this call would have somebody we could refer. And a lot of my clients actually have brokers that they've been working with through the years. So
Okay,
we can talk about that in the consultation as well.
great, great. I appreciate that. And again, it's my aunt and uncle's condo. You know, they're getting older, and I'm not really actually 100% sure what their plans are. You know, they might want to sell, and you know, who knows, and what makes
Right.
selling in this phase of life different.
Well, I wanted to introduce you to somebody because my parents have gone through this. It sounds like you've just gone through this, where I think the next thing, maybe you should talk to somebody who will navigate you through, God forbid, new healthcare or some assistance needs to come into the home while your aunt and uncle are living there. And I'm going to throw you back to Mona Mueller, who also handles assistance with that process. So can I get her back on the line for you?
Yeah, that'd be great. Thank
Are
you.
you available to kind of talk about some care if stay at home? Can you help us with that?
I would love to. Thanks so much.
Thank you. Rick, Mona's back on the line.
All right, great. Hi, Mona.
Hi, how are you?
Good to talk to you again, but on a different subject. So thinking about my aunt and uncle, you know, they're doing okay now, but I've, you know, seen this before, you know, as we get older. How do we know that it's time to ask a professional to help with the care in their daily lives?
I can tell that you care about your aunt and uncle a great deal, and it can be very stressful. You know something is wrong, but you're just not sure what it is and what kind of assistance that they need. And as all of us know, navigating healthcare can be incredibly stressful, and it changes all the time. That's sort of where I come in as a healthcare advisor. I like to say it's a trusted person. It's like a family member with a medical degree. So I go side by side and help people navigate those changes. So some of the triggers that you might see is your loved one or your family member becoming sad or becoming frustrated easily, or their health declines. My job is to make sure that you have options. I sort of call it like the quarterback of a team. I'm surrounded by team members, and my job is to shepherd you and guide you through those choices and offer them with the goal of being as independent and living life as functionally as you can.
So when the time comes, it sounds like you might be there and be able to help me understand what they need.
You bet. And in the nursing standpoint, Steve had mentioned this before, but it's called activities of daily living. What do they need to do self-care on a daily basis? And that's what we really try to assess. And that's where we can come in and help and get people into help. One of that could be, meal prep and getting groceries because they don't feel comfortable driving, and making sure that they eat because nutrition is really important. Another big thing for seniors, believe it or not, is medications. They forget to take them. They don't know where they're at in the home. So having someone come in, organize them, remind them to take them. And then mobility is a big factor. As we age, we fall more frequently, and we get scared that we're going to fall because of the injuries. So assisting with a walker, a wheelchair, and then also dressing. Sometimes we just need help with dressing on a daily basis. The nice thing is that you can get people in the home, and it can vary from senior to senior. It could be 4 hours a day to 10 hours a day. It's whatever they need to maintain the kind of lifestyle and the happiness in their home. And as their health deteriorates, that's where I can help you to look at other options if they can't live at their home independently.
Okay, so speaking of the other options, I'm sure that considering like assisted living would be one of those options. Is that an area you can help with?
It is not that I can, but I know a wonderful gentleman that can. Dave Holder. Would you like to talk to him?
Absolutely, I'd love to talk to him.
Dave, are you available to talk to Rick about options for his aunt and uncle?
I sure am. Thanks, Mona.
Mhm.
Hey, Rick.
Yeah, how you doing?
I'm doing great. Thanks.
Good. Well, so it's probably a little bit away, but my aunt and uncle, they're getting older. And Jesse said that to talk to you, um, you know, about, the next step as they get to that point, the care that they might need. What
Sure.
exactly is it that you do?
No, that's great. So I'm a senior living advisor, and I help families and seniors navigate senior living options out there. This is a huge change for everyone involved, and there's a lot of layers to that. But I focus on independent living communities, assisted living communities, and memory care communities. You can kind of think of me as like a senior living realtor. So just like a realtor, we'll talk about what options there are, what budgets, but we'll really do a deep dive and talk about the care needs, long-term plans, safety concerns. I provide recommendations, and just like a realtor, I'm there going on the tours with you. So my goal is that you make the right decision the first time with a lot less stress and anxiety.
Awesome. Well, I've done this before, and I've seen family and friends go through it also. And one of the things is, when do you start the process? When is the time to have this conversation?
Honestly, Rick, it's never too early. The real key to this whole transition, whether it's to independent or assisted or memory care, is to be as proactive as possible. So I made the realtor analogy earlier. Families don't pay me for my service. So just like a realtor, when you go to buy a house, the seller pays the referral fees. There's no cost to work with me. So you're not wasting my time. 6 months, a year from now, have that conversation. I'm probably going to be able to tell you something that you didn't know about. It might be able to pivot your plan, but staying proactive is the key to having a successful move.
Okay, well, this is one of the big questions. My aunt and uncle aren't necessarily on board with this. How should I approach them?
That's crazy. Everybody's on board. Everybody wants to do assisted living. Come on. What's the deal? No, I hear that all the time. And really, one of the biggest misconceptions that I hear, especially when going honestly into any senior living, is that I'm going to lose all of my independence. And the first thing to know is that really the opposite is the case. The communities are designed to provide assistance, but to keep them as independent as possible. So the sooner they understand that they're not going to lose anything, that they can get a little support, but come and go. And there's people in assisted living that still drive their cars. That really will change their mindset. The other thing is, have the conversation, be prepared to have it a couple different times, because it'll take a while for them to wrap their heads around that. And it's a big change, especially moving out of their condo. I'm sure they've been in there a long time. There's a lot of things. So you need to be prepared to have that a few different times, but again, have it as early as possible.
It seems like really great guidance. So what are the steps in your process?
So really, I kind of break it down to 4 steps. We will have a first conversation and kind of explain what I do, but we'll really kind of do a deep dive. Well, we'll talk about like that location and budget, but we'll talk about long-term goals, what amenities you're looking for, activities. We'll really get into that because we're looking for a new home. The second part of that is I'll provide some recommendations to make sure that I'm on the right track for what they're looking for. If they like those options, I set up the tours. So I'm right there with them, kind of wearing that realtor hat, a little bit of an advocate. And then the final one that I like a lot too is just the decision-making process. Your aunt and uncle are ultimately going to make the decision about what community they want to go to, but I love being involved to talk through those options, play a little bit of devil's advocate, be that advisor for them, and then make sure that they have a great move.
Yeah, it just has to help to have somebody like you there, because it's a big decision and it's a very emotional. So I can see how that's a huge, huge help. My family has dealt with dementia before, and we just weren't prepared.
Sure.
I'm still not sure we're prepared, but do you have any resources that can help a family understand the dementia signs?
Oh yeah, absolutely. I have an awesome one. It's Jessie Hillock, and she's the owner of the Memory Compass. Let me get her on the line. Hey, Jessie.
Hi, Dave.
Hi, you're the perfect person to talk to Rick about dementia.
All right. I'm looking forward to speaking with him.
Hi, Jesse. It's Rick.
Hi, Rick.
Hi. To give you kind of the background, I'm looking for my aunt and uncle. I've started to notice that they are starting to have difficulty managing their medications. Same thing my parents went through. The prescription bottles say that there's 30-day refills, but most of the pills are still in the bottles. I have noticed that mail piling up, and some of the mail has bills in it. When I ask my uncle about it, he kind of gets defensive. And I'm noticing that my aunt is also starting to call and share stories, 2 or 3 times or more sometimes. And I'm starting to have some concerns with their memory. What should I do?
Yeah, well, Rick, you have some wonderful questions here, and I call myself your family's personal memory loss navigator. So I help families who are trying to have a better understanding of this disease through consultations. And then also, if your loved one's near the area, I am able to provide them with therapy services as well. So the loved one with the diagnosis. But I think first, a good thing that we should kind of consider is what's considered normal aging and what's not normal aging. This is a really scary topic. People are really fearful of if they're going to have dementia. So just to kind of clear up the air a little here, the normal aging is, you could maybe forget the names of people that you worked with many, many years ago. You could have some increased difficulty with multitasking, kind of that slower processing speed. Our body slows down, so our brain slows down a little bit too. You could misplace your keys or your wallet, but the key here is that you can misplace these things, but you're able to retrace those steps eventually with time. All of those things are considered normal aging.
Okay. That's it's great to know because it worries all of us. What are the signs I should look out for that could mean things are maybe a little bit more advanced?
Yeah, so oftentimes you'll see some changes in mood or behavior. Individuals will have an increased difficulty with word finding, increased difficulty with finding names of familiar people. So not necessarily coworkers from years ago, but actual names of their grandchildren or their children. That's when there's some red flags. They can have difficulty sequencing through familiar tasks. We don't really think about how many steps are involved in our day-to-day activities. So when people start having difficulty with using the washer and dryer or, using the microwave or, my goodness, using the coffee pot, those are kind of, red flags as well when you have that word finding with it. And then also the medications, the finances, their sequencing and safety with all of that. A big one is weight loss. You could notice that maybe you are starting to deliver meals to your loved one and you open the fridge and they're all still in there and they haven't been touched. That's when you can see, is it a sequencing thing that's going on? Because there's so many steps involved in taking it out, putting on the plate, warming it up. There's an actual really great questionnaire for families. A lot of times your loved one will go to the doctor and they'll be asked, how are you doing? And they'll say they're fine, because we all say we're fine. But there's actually a questionnaire specific for family members, and it's called the AD8. So that's A as in apple, D as in dog, and 8 as the letter 8, or as the number 8. And it takes about 3 minutes to fill out. It's very brief, and based off of the questions that you answer, you'll be able to see if there's 2 or more areas of concern, then it's really important to get your loved one seen by a healthcare professional.
Well, that sounds really helpful. I think so for sharing that. I appreciate it. What do you recommend if they are demonstrating these signs?
Yeah, so I recommend, having them go see their primary care physician and having a list. I recommend definitely that family go with their loved one, because again, like I said, they could just say, I'm fine, because they might not remember these things that you're seeing. So having someone accompany them, you have a list of things written down, you go over those with the doctor, and it's okay to request, should we be going to see somebody outside of just our primary care physician? There are amazing geriatricians in the area, neurologists, neuropsychologists. I highly recommend individuals not just see their primary care physician, but these other specialists as well.
Great, that's awesome. Now, if my aunt and uncle seek out these professionals and they receive the diagnosis, what should I do?
Yeah, so typically the neurologist will follow your loved one. They might say, I'll see you back in 6 months, I'll see you back in 12 months, but I definitely recommend having support services in the in-between. There are resources out there, such as our local chapter of the Alzheimer's Association. There's different support groups in the area. There are ways just to better understand the disease, with someone like myself, helping navigate what are the changes that are taking place within the brain. But we definitely want to be proactive in a very reactive world. So I recommend having a therapy assessment, and just learning from these local resources within our area.
This sounds like really important choices to make, and I'm kind of concerned about all the legal questions, especially, as I get older, the possibility of having trouble making decisions. Is that something that you can help with?
No. I get the legal questions quite frequently. And for that, I want to connect you with Rebecca Geyer. She is an elder law attorney. So let's see if we can get her on the line. All right, Rebecca, are you there?
I'm here, Jesse. How are you?
Good. How are you? I'm going to connect you with Rick.
Great. Thank you. Happy to help.
Hi, Rebecca. It's Rick. I appreciate you getting on the call. I was just telling Jesse that my aunt and uncle, they're going to be able, they may not, it seems like they might be able to act on their own, but it's hard to tell. And are there any legal documents that we should have in place while they are basically okay? I guess my question is, what should we be doing?
Yeah, that's a really good question, Rick, and one that I think most families should really take into consideration. There's really two sets of things that need to be put in place. One is a set of legal documents, which I'll talk about in just a minute, but there's also just some common sense things that people should consider making sure that the individuals they want to act on their behalves have, so that in the event a situation arises where they cannot act for themselves, the person acting for them has the information they need to act swiftly and accurately in accordance with their wishes. So your aunt and uncle should really consider making sure that you have basic information like copies of their health insurance cards, a list of the doctors that they see, a list of medications. So lots of people are so used to taking care of their own health care that they don't think about providing this information to someone who might assist them in the future. But we really don't have true electronic medical records. You might have them if all the doctors are in the same medical group, like they're all IU Health or they're all St. Vincent's. But if your loved ones cross medical groups, you're going to have to supply the medication information for each medical doctor or practice that the aunt and uncle sees. So you're going to want to make sure you have that information. You're also going to want, I was going to say, you want to make sure you have financial information too. Many people are private and they don't like to share their financial information, but it is important to ask your aunt and uncle, what types of income do they receive? Do they get Social Security or a pension? Where do they have assets? Your loved ones can share basic information about the sources of income or where they might hold assets, such as account numbers, without actually having to reveal the amounts there if they want to maintain privacy. And then one of the biggest things that I see is people will sometimes do the legal documents that we'll talk about in just a minute. But in addition to getting legal documents in place, they don't often provide that information to the people they've named in those documents. And in order to really help them, you need a copy of things like powers of attorney and healthcare documents. And the last thing I would say, in addition to a list of advisors that might currently assist your loved ones, you might ask them how many things they do online, because passwords have become a major issue when we're trying to assist people. We do more and more on an electronic basis. And oftentimes, in order to access account information, we need to know usernames and passwords. And many people never provide that information or even a way to get into a phone or a computer password so they can access basic information. So those are common sense things that you should seek to get from your aunt and uncle now while they're healthy, so that you're equipped to manage things in the event of an emergency.
That really sounds smart. And passwords, it's my wife's nemesis. She hates passwords. So beyond all this contact list, the insurance cards, the passwords, what else should we be getting?
Well, they should definitely consider having some legal documents in place. We want to make sure that someone has the ability to act for them, both from a financial perspective or to make healthcare decisions, so that we don't have to go to court and go through a legal guardianship proceeding should an emergency arise and they can no longer take care of themselves. So a document everyone should consider having in place is something called a durable power of attorney. And that's a document that would allow your aunt and uncle to designate you or someone else they trust to handle financial transactions for them if they ever become unable to act for themselves. The great thing about this is they're not giving up any control of their finances now by appointing you to serve in that capacity. They're just making sure that should there be a time when they can't act for themselves, you could step in and have access to financial information or contact their advisor to withdraw funds which might be needed to support them or pay taxes. Without that type of document in place, we would have to go to court, as I mentioned before, to have a legal guardian appointed in order to assist them from a financial perspective. The other document your aunt and uncle should really consider having in place is something called an advance directive for healthcare decisions. We passed a new law in Indiana last July, and we overhauled our healthcare documents. If people have existing healthcare documents like appointments of healthcare representative or healthcare powers of attorney or living wills, those were all grandfathered in under the new law. But for people who don't have those in place, when we draft documents now, we use one combined form called an advance directive for healthcare decisions. And that would allow your aunt and uncle to designate someone to serve as their healthcare representative if they become unable to make healthcare decisions for themselves. That document would give someone the authority to have access to medical information, hire people to assist them with care, consent to surgery, admit them to the hospital or release them from the hospital. It even includes a few decisions after someone passes away, like decisions about organ donation if we didn't know their wishes, or whether or not an autopsy needs to be performed, and that person even carries out funeral arrangements. The new document also allows them to determine any sort of end-of-life decision-making that they would like, and they even have the ability to write in their own words about the types of care they would like to receive or would not like to receive in this document. So they should definitely make sure that they put documents in place to cover both financial and healthcare decisions now while they're capable of doing so.
All right. Well, that is a big list of documents. So that definitely is something you need help with, it sounds like. But to change gears on you just a little bit, they have been saving, but of course, people live a long time these days. What if they run out, don't have enough money and they run out of it? And is a nursing home the only option?
That is a really good question. I think that's one of the biggest things that people are concerned about as they age. I've yet to have a single person come to my office in 23 years and say they can't wait to spend all of their life savings on a nursing home. Luckily, in the state of Indiana, we actually have what's called an age-in-place system. So what that means is as people age, we don't necessarily look to just a nursing home and to provide them with care or services. Even under our state's Medicaid program, we can allow people to age in their own homes because we can now use Medicaid to pay for things like home health care, adult day services, meal delivery, transportation. It can also be used to pay for assisted living or memory care. And then as a last resort, it would be used still in a traditional nursing home. But it's really nice that we have the options to assist in helping to pay for care. And we can do so really in a situation that is going to best meet your aunt and uncle's needs without making them go to a place that's going to be more confining than they might need at the time.
That's great to know. They're also worried that what if one of them gets sick and the cost of care ends up bankrupting the other person? Is there a way to address that?
That is a very common concern, and I see it a lot with spouses. Many people live on their income in retirement, and they're really concerned about what might happen if one of them needs care and the other spouse is at home. It can often be a concern, especially I find for the wives, because many times they were homemakers and they don't have as much monthly income as their husbands, and they're concerned about how they'll be able to make it if, for example, their husband is in a nursing facility or even assisted living, and they don't have his income to live on anymore. And I like to reassure people that we have a whole set of rules which exist under our Medicaid laws that will protect the spouse who is not in need of care from losing all of their assets. And those are called spousal impoverishment rules. And under Medicaid spousal impoverishment rules, certain assets are automatically protected for the spouse who is not in need of care. So for example, if you have a couple, one spouse needs services, the other does not, the home in which they reside is going to be protected for the spouse who is not in need of care. In addition, if they happen to own any other real estate that is in the name of the spouse not in need of care, it's protected automatically. And Indiana is one of only a handful of states that also automatically exempts any retirement accounts like IRAs or 401ks in the name of the spouse not in need of care. Beyond that, Medicaid is going to look at the assets which belong to both spouses, and the spouse who is not in need of care is going to be able to keep 1/2 of the remaining assets, we call those countable assets, up to a certain maximum. In 2022, that maximum is $137,400. So there's quite a few things that are automatically protected, as well as a certain portion of their assets that can be set aside. And then people consult with elder law attorneys like me if they have the need to conserve additional assets or, make sure that those are set aside for the spouse not in need of care's future expenses.
Well, I really appreciate your time. We'll definitely be following up. Thank you so much.
My pleasure.
Now, that's the end of the presentation. I know we covered a lot of ground, and I think hopefully after watching, you feel that it was something that is going to be very helpful to you down the road, and that you appreciate the information tonight. But our goal is to help show each of you these resources that can help you stay, or your family members stay proactive. Whether whenever they're, no matter what the step is in the process that you're in, and help connect the dots on how to use these resources and who to contact and who can assist you for these resources. We'd like to open up the floor for questions. You should have received an email with everyone's contact information. Dave, I'll turn it over to you.
Thank you, Rick. We might just start calling on people. If you don't have any questions, we're gonna, or do a pop quiz. It's okay if you don't have questions. Don't feel pressure. But if you had any, you can ask. Judy, you can. I thought I unmuted everyone.
There we go.
There you go.
I think this is a question for Steve Stevens. I'm a power of attorney for my stepdad who's in assisted living that Dave actually helped facilitate that process. He does have dementia, but he's decided that he's drawing Social Security, but he's afraid he's going to run out of money. He thinks that Social Security that he's not going to be able to have money. Does it have a finite end?
Sorry.
There, perfect, thank you. Finite end as in Social Security will end at some time, is that the question? Or is Social Security
He's afraid he's going to run out of Social Security money.
The only way that he'll run out of Social Security money is when the good Lord calls him home. Because that's when the benefit would stop. So yeah, he really can't outlive his Social Security benefits.
Perfect.
Now, they might be used to go towards his care, but he won't be able to outlive them. Does that help?
Will put his mind at ease.
Any other questions? Judy got the first question, so she wins $100,000. So shame on you guys for not asking. Sorry, we only had $100,000 to give. Judy, Steve will pay you. And no pressure. If you don't have any questions, you've got all of our contact information. Feel free to reach out. And I think the theme tonight was certainly staying proactive. So I encourage you guys to touch base with any of these great resources to assist you and as you go through those next steps. Thank you so much for joining, and we really appreciate it. Thank you. Have a great night.